New York City has some of the best hospitals in the world. I think we all know that. But the healthcare system is very disproportionately accessible or inaccessible to some. And it's also somewhat fragmented in that you have New York City Health and Hospitals, and then you have a number of private chains and networks, and then you have urgent care providers. And unfortunately, these systems are not designed to communicate with each other, which in this time is actually mission critical. And so the theme I'm going to talk about a bit, although it's not going to be the sole theme of our healthcare policy, but this is the way my mind works, is information. Is that in an emergency, having information is the difference between life and death. And right now, the information that New Yorkers are getting is incomplete, where if you are trying to get vaccinated right now, there are a number of places where you feel like you can sign up and you're not sure if you're signing up in all of the right places. You're not sure if you are being queued up to get the vaccine as quickly as possible. And so it's been a source of frustration to New Yorkers. So one of the things that the mayor and City Hall can do is to try to coordinate different organizations and have them talk to each other in a way that will then be able to present information to New Yorkers more effectively. So if we look at the vaccination process, there is number one, the intake. And of course, there's a supply, but there's also signing up, the information you have in terms of where to go, where your nearest vaccination site is. Then the second is this distribution element. And as you can see in the plan that we've put forward, we think that we need to be more creative about trying to get the vaccine closer to people, because it's not going to be easy for a lot of New Yorkers in Ritchie's district in the Bronx, or parts of Brooklyn, where Dara is, or Queens. I think we have all the boroughs where Ron is, where folks may not be able to easily hop on a subway or bus and go to a vaccination center or a site, or even their local pharmacy, which we should be trying to get vaccines to. So we have to do everything we can to try and get the vaccine to the people, as well as bring people to the vaccine. We should be going in both directions. And right now, there are some underutilized resources that we may be able to take advantage of, including bars and restaurants. They may have refrigeration capacity that's not being utilized right now, or even, and this may sound, may sound a little bit interesting to folks, but ice cream trucks, where you have a lot of ice cream trucks that right now are not exactly being utilized right now. They have refrigeration capacity, and at least some other communities have been using those trucks as mobile vaccine sites and distribution nodes. So number one is the information you need to find out where you can get vaccinated and know that that's the right process and the best way. Number two is trying to get the vaccines to people in an equitable way that's accessible and rises to the challenge that we're in. And then the third element is the information you get and can present to people after you've been vaccinated. So we're going to have this vaccination adoption curve throughout the next number of months. But then after you get vaccinated, what does that mean for you and your family? Do you then feel like, okay, now that I've been vaccinated, we can all go out and go to the restaurant or the bar, or even at the high end, like a concert or theater? And so one way we can actually get New York City back on its feet and accelerate the recovery is for people to be able to quickly present and verify their vaccination information on their phone if they have one. And we'll have ways to do this that don't include a smartphone if you don't have a smartphone, but the smartphone would be the first choice. And at least for a certain period of time, as the vaccine is being rolled out, it could even include negative tests. And many of you know that right now, like that's the situation I'm in, where I'm just getting negative tests. But there could be a way for you to signify very quickly. It's like, look, if I have, like, this is my vaccination information, and let's say this is like the last time I was tested, as a way to provide folks that reassurance that when you enter that office building or restaurant or whatever it is, that they understand what your status is. So this to me is going to be a vital element of getting the city back on its feet, for people to be able to quickly convey their vaccination information. And this is something the city needs to invest in. Now, when I say invest in it, one of the things that I'm expert at is finding other people who are doing things and then augmenting or elevating or putting resources to work to help them. And so when it comes to a vaccine passport on our phones, there are actually various firms and organizations working on that right now. And I'm excited to find the best provider and have them become the tool that the city uses to accelerate its recovery. So that is the vaccine distribution. We also released a mental health plan. And I just want to share a personal anecdote before I pass it along to my friend, Dr. Dara Kass. I was referred to a counselor in my school when I was 14 years old. And I'm not sure exactly why, frankly. I mean, like, I probably seemed, I was not exactly like a happy, gregarious seeming 14-year-old. So there's probably that. But I remember being referred to this counselor. Her name was Sue Denby. And it was great. Like I got a lot out of it, had a really good relationship with her. And we have to know that a lot of our kids are being traumatized right now. Like them being not being in school during this time has set many of them back. And that even if we're fortunate enough to reopen our schools in the months to come, there are going to be kids who are unpacking trauma and depression and other negative experiences from this time for months and years. So we need to have more counselors and resources and social workers available to our kids in particular in the school environments, and not imagine that they're just going to bounce back 100% in every case. And so I believe very, very deeply that this is something that we should be investing in, that we need to be investing in mental health resources in our schools at higher levels. So grateful to everyone for being here today. And I'm going to pass it to my friend, the incredible Dr. Dara Kass. Yay, Dara.
I'll take the applause. So I just wanted to set the stage for why this is so important right now. I think in the past 48 hours, even our world in New York has changed. Watching the Biden administration roll out really a 200-page national strategy to support states and cities, to empower governors and mayors to really get us out of this pandemic as we roll out a vaccination process that's been subpar. But New York City and New York State, but even New York City specifically, has shown us what is possible when you open the access to the vaccine and how many people will show up. And so what we're dealing with this week, and specifically today, I was supposed to be vaccinating at a city clinic today, which got canceled because there's no vaccine. And so when the federal government catches up to the moment and really is able to distribute vaccine to the cities and to the states, and we're able to really now execute on the ground, the question is, how are we going to do that in a way that meets this moment? And for me, that's going to be innovation and entrepreneurship in addition to the traditional infrastructure we have in New York. One of the things that's remarkable is we have so many top tier medical centers in New York City, yet we have so many people that have no access to public health or preventative care. And as somebody that has worked at hospitals that have both private and public hospitals in partnership, and we see what happens to patients depending on what side of the street they live on or where they show up, it's really important that the next mayor of this city understand that we have to get deep into those, the infrastructure of that inequity and really build it back up. Because if we don't, we're just going to perpetuate so much of what's happened badly in the past. And with this pandemic, we've learned that we have to iterate quickly. We have to iterate information, we have to iterate communication, and we have to iterate our understanding of what this means for our people. It's really important that as we learn more about how this virus is transmitted, we empower citizens to stay safe in their homes. Right? It's great to say everyone should get tested, but if we don't facilitate how and when to travel to the test, if we don't empower people to be home for a day after their vaccine, then they're going to avoid that second vaccination if the first one gave them a fever and headache and they're not able to show up to their shift and they're going to be unpaid. So I just want to make sure that as we have this conversation with, you, Andrew, and both Ritchie and Ron, but the idea that we have a conversation centered around the needs of New Yorkers and what they're going to need in the next year, 2, 3, coming out of this pandemic, and the opportunities that what is a really broken system will provide us to build back in a way that's accessible and healthier for all of New York. I'm done.
Hey, Dara. And now I think it is Congressman Ritchie Torres. Welcome back from the inauguration, Ritchie.
Thank you, Andrew. It's always an honor to be with you and with Dr. Kass and Assemblymember Kim. Like many New Yorkers, I was deeply affected by COVID. I was one of the first elected officials in the country to be diagnosed with COVID back in March during the peak of the pandemic. And the Bronx was among the earliest and hardest hit by COVID-19. It was the epicenter of the epicenter. Those in the Bronx and those in communities of color had twice the likelihood of dying from COVID-19 compared to the rest of the city. And the Bronx has a disproportionate share of our essential workers who face among the highest risk of contracting the virus. We have overcrowded apartments because of the affordability crisis, and those overcrowded apartments became petri dishes for transmission within the home. We have a high prevalence of pre-existing conditions because of food deserts, because of a lack of access to quality healthcare. And those pre-existing conditions like obesity and cardiovascular diseases made our community especially vulnerable to the worst impact of COVID-19. So all of those forces combine to create a deadly perfect storm that took more lives in the Bronx than the loss of life during 9/11. It's been a catastrophe. And I feel like it tells a larger story about systemic racism, which in a deep sense is the single greatest risk factor for COVID-19 morbidity and mortality. And so with that in mind, I just want to thank you, Andrew, for putting forward a plan that centers communities like mine and that represents the most comprehensive response to COVID-19 that we've seen presented in the mayor's race. And I appreciate in particular your emphasis on mental health. I've spoken openly about my own struggles with depression. I take an antidepressant every day. And I know that the experience of losing your livelihood, the experience of struggling to sustain your own family, your own children, the experience of watching your neighbors and friends and family members die en masse, all of that is profoundly traumatic. And those traumas are going to linger long after the disease itself becomes a thing of the past. So we need a mayor like you who's committed to improving mental health, who recognizes that mental health and physical health and public health are all inextricably bound together. My final comment is I appreciate really your understanding that economic health and public health need not be mutually exclusive, right? You have proposed creating a vaccine verification app that would enable us to achieve both, that would enable us to accelerate the economic recovery for our city. So I'm supremely confident that under your leadership, New York City will be the post-COVID comeback city.
Thank you so much, Ritchie. Really appreciate it. Means a lot. And we all know your community has suffered more than just about any other community during this time. People have seen it. I know I talked to Dara as well about healthcare workers and the essential workers that are seeing it, or have been seeing it every day for months. Ron Kim, are you here? I don't see your handsome face. Oh, there you are. Assemblymember Ron Kim from Queens.
Thank you, Andrew. Thank you for having me. Dr. Kass, it's good to see you. Congressmember Ritchie Torres, congratulations. It's good to see you, my friend. So Andrew, I haven't told this to you, the details of when you, Evelyn, and your kids came to visit me in Flushing late December. That very morning around 6 a.m., I had to drive my father to the hospital for a planned surgery. He had to remove his kidney due to cancer. Following a long but successful procedure, we expected him to come back in 3 to 4 days, but he ended up staying for more than 3 weeks due to post-surgery complications. From pneumonia to a mild heart attack. There were times when he was intubated unconscious for days, and there was no way for us to see him due to COVID. My mother cried herself to sleep every night because for 40 years, her and my father had never been apart. My dad, he recovered, and they recommended him to go to a nursing home for physical therapy. He refused and came back home to be with my mother. So I share this story because, you would think that our city, with world-renowned healthcare institutions, would be the very best at making sure older adults, like my parents, received COVID vaccines as soon as possible. But for millions of seniors, there is no vaccine in sight. So during the first wave, I helped expose the mismanagement of nursing homes that led to thousands of deaths in New York City. I would have hoped that we learn quickly and prepare for efficient and equitable administration of the vaccine shots. And as the chair of the Asian Committee in the State Assembly, so I'm not here with Andrew to blame people or find scapegoats. I'm here to find solutions with the next mayor of New York City, Andrew Yang. Like, I want a mayor who will not sleep until every administrative and bureaucratic inefficiency is fixed. I want a mayor who is willing to learn from mistakes, recalibrate, and collaborate with others to utilize every resource available to our city and state. I want a mayor who are most vulnerable older adults and those with underlying conditions like my father can look to and trust. So I'm proud to be here with you, Andrew, and I'm so proud that you put together this comprehensive response to COVID and your first public health policy. And I look forward to being with you for the rest of the campaign season. Thank you.
Thank you so much, Ron. How is your dad home now? Is he resting comfortably? Like, is everyone all right?
He's home, and he's being stubborn again and refusing to eat all the healthy food. He's requesting some ice cream and all the bad stuff that he's used to. So that's the hard part right now. We're trying to manage his diet, but he's starting to walk and recovering slowly. So we're very grateful. But again, it'd be nice to know that he's on a list or he'll be vaccinated soon, and there hasn't been any communication whatsoever.
Well, certainly he and your mom, it sounds like they ought to be among the first in line, because like that they both seem like they're over the age of 70 and high risk. So yeah, like a lot of people would agree with that. And just speaking, I mean, my dad's 81, and so like the story you told about your father in surgery, like I think everyone has either gone through something like that or has that in their mind. So thank you, Ron.
We will open it up to questions. I'll just play traffic cop a little bit. We'll start with Benjamin Fang, Queens Ledger.
No questions for me, thank you.
Sounds good. Bridget, WNYC, Bridget Bergen. No.
This is my kind of press conference. No, I'm just kidding.
Amanda Eisenberg, I know you've got a question. No?
Hi, everyone. Good afternoon.
Great.
Mr. Yang, I wanted you to talk a little bit more about the vaccine passport. We talked a lot about equity today, but there are a lot of people in New York City, especially older people and in communities of color and low-income neighborhoods where they don't have a smartphone to be able to kind of show their way into going out to restaurants or rejoining society. So if you speak a little bit more about what your plans are for that subgroup.
Thank you for the question. There has to be a way for New Yorkers to be able to verify their vaccination information, for them to be able to get together safely and confidently. And we're going to make sure that that's possible for every New Yorker, regardless of whether you have a smartphone or not. So the universal documentation that accompanies your vaccination is you get a vaccination card. And so the advantage that having it on your phone provides is that we can then take the information on that vaccination card and then cross-check it against existing databases that confirm your vaccination information. But in the absence of that, there are other ways that we can also confirm your vaccination information. And that vaccination card itself would be the most powerful documentation that anyone can have that accompanies anytime you get a vaccine, because it will show who you are, the date, whether it's the first dose, like the administrator. So there will be ways to confirm it regardless of whether you have a smartphone or not. But the smartphone does add utility And so we should try and take advantage of that utility even while we're being inclusive of those who may not have one.
Are you worried about discrimination in any case where people are trying to go out and they might be using this sort of system, and it might open doors to people not being allowed in places?
Well, I'm more concerned right now about trying to get everyone a vaccine, and then trying to make sure that after they are vaccinated, they're able to communicate that. I'm confident that there are ways that we can give people that ability to reassure folks that they've been vaccinated while being inclusive. Like I don't foresee an establishment somehow turning down folks who have other forms of confirmation of vaccination. And if that does happen, then like we would put a stop to it.
And I have another question, if the press corps will allow me. I don't want to take up other people's time, but I was hoping that you could elaborate a little bit more on the mental health element to your plan. You mentioned that you want to expand social work and mental health services in city schools. The de Blasio administration announced, I think last month, that they were aiming to do that. How do you see Thrive interacting with these plans? Can you speak a little bit more to that?
I think that many people would agree that Thrive had the right goals, and that mental health is key to our overall health. And at the same time, I think many people would agree that Thrive may not have achieved its goals as much as we would like to have seen. And so the goal with Thrive should be to take the resources that have been built that are productive and we can repurpose and put to use to try to move the ball forward in terms of resources for New Yorkers. I'm deeply committed to helping New Yorkers feel better every day in ways big and small. I think mental health resources are a huge part of that. And I want to see what elements of Thrive we can keep moving forward.
Mike, Daily News.
Hey, can you guys hear me?
Hey, Mike, I can hear you.
Hey, how you doing? So I had a couple of questions in a couple of areas. On Thrive, what do you see as where do you see kind of the successes and failures on that, and how is what you're proposing different from it? How would it be different?
Well, I think the success is that the goal was admirable and the level of resources dedicated to it were very significant. I think many people would take issues with the implementation and the measurement, where some of the impact was a bit less clear. But I think the needs in our schools in particular are going to be very significant. It really, like in all of our communities, is going to be very significant. I think I saw something along the lines of like 6 out of 10 people have had like struggles with depression over the last number of months because of COVID. So the needs are going to be everywhere. And to me, the goal has to be to try to provide resources in a way that will actually drive measurable improvement. And I think a school setting is an ideal environment for that, because if the school's open, you'll see the child every day. And then, not to say that necessarily the counselor will see the child every day, but that's a way that you can actually drive impact. And I think that was one of the frustrations folks had with Thrive.
How do you, with something like Thrive or mental health in general, how do you measure success? I mean, I know this might be kind of sound like an odd question, but I mean, I think I have a sense of it, but how would you, I mean, how do you deem something like that successful? How do you kind of report that out, I guess?
No, well, I think anytime you can prevent a negative outcome, like that would be a success. And so you can have, let's say, a number of people in need, and if they're able to see someone, you can measure the level of intervention and then the outcomes for the people that received that help. And then you can unfortunately see what happened in groups of people that did not receive any assistance. So there are going to be very clear indications of whether we were able to help people.
Thanks. The other question I had to do with the integrated vaccination protocol you'd mentioned, a portal, sorry, that you mentioned before. what do you see as kind of the hurdles to that? Are there privacy considerations? I know this is a pretty complex issue, but are there like, 2 or 3 that you could kind of name that you see as kind of the first problems that need to be attacked and kind of getting to a point of success with something like that?
Yeah, the issue is getting different organizations' information systems to be able to talk to each other in a way that is secure. And so I would suggest that at least on the intake, this should not be as great a problem, because often you're just trying to make available what the vaccine appointment schedule is, which is not the same as, frankly, confidential patient information. And then on the outgoing, the only information you're trying to provide is someone's vaccination history, which, while it is private, it's not the same kind of health information that I think most of us think about. So the issue is that a lot of these healthcare systems have very, very correctly highly regulated information systems around what they are and are not able to share. And they have IT administrators who are very, very security minded, and that's all correct. The question is, can we get these systems to talk to each other and share information that is not patient information that would help people be able to figure out their ideal vaccination appointment destination and time, and be able to share information that would be integral to our recovery as a city. So that is, it's partially a technical challenge, but a lot of it is going to be getting the right people together and say, look, this is mission critical for the city. And the tough thing is, if you're in one of these organizations, your job is not necessarily to talk to the other system. You know what I mean? Like you're running your system, you've got your body of patients. The problem is right now that for New Yorkers at large, this does not help us speed up at all, because you've got these different hospital networks that have their own databases. They don't talk to each other. They don't talk to us. So that is the nature of the challenge. It's a leadership challenge. It's partially a technical challenge, and it's partially clearing administrative hurdles within organizations.
Can I jump in for a second? Because we've seen this before, the model of verification of information by a third party that would make accessible. And the idea is that it shouldn't just be to certain people, but it should be available to everybody. And vaccinations, if they're offered to everybody, it's not the idea of discrimination against not being vaccinated. If there is no vaccine available to you, then that's one thing. But if you've chosen to not get vaccinated for another reason, but you have a negative test, that would be a way around a system of not being vaccinated. So the idea, and again, from a patient safety perspective, is that there's a third party verification system, whether it's run by the city or a private company, that allows us to communicate easily so that people are empowered to get back to doing the things that they need to do to live in this city. So I think that taking it a little bit away from the information systems in the hospitals, but bringing it a little higher level is, I think, the vision of what this vaccine verification app or some other central system would look like.
Thank you.
Thanks, Mike. We'll jump to Intercity.
Sure. Thanks a lot. Thanks for doing this. I wanted to, I haven't seen your whole plan, but I wanted to know if you could speak to how vaccinations and just the dealing with the COVID pandemic generally, what your plan would mean for both courts and people that are incarcerated. There's a lot of more and more cases are getting pushed back. People are some people are pleading guilty simply because there's no trials on the horizon. What are your thoughts, whether it's about the vaccine passport or otherwise? What are your thoughts on this topic?
And that's just one of the tragedies of the pandemic, where there are folks who are having their legal proceedings pushed back, and then are now, it sounds like, making decisions that they would not make otherwise. I like the fact that there were measures early on to try and reduce the incarcerated population, and let some folks out in part for safety reasons, to avoid the pandemic spreading behind prison walls. So I think this is like a very, very negative consequence of the pandemic. And to the extent that we can help alleviate that, perhaps by saying to folks that maybe they should not be incarcerated during this time, like if there is, for example, a bail voucher program or something we could have in place so that folks don't feel like they need to make a decision based upon their current circumstances.
Great. Thanks a lot.
Thank you. Eric Stelzer. News 12 Brooklyn. Good.
News 12, the Bronx as well. I just want to be.
Oh, Richie, don't go there yet.
I know they have different anchors. All right. Ben or Ben Max? No. And last call, Elizabeth Kim, Gothamist WNYC.
Thank you. I want to hear more about the plan to make restaurants and bars and ice cream trucks vaccination sites. Can you walk me through how that's going to work?
So, Elizabeth, this is something to try to get vaccines to people. It's not the first move. Like the first move is hospitals, pharmacies, vaccination sites, and community centers. But then if you look at particular neighborhoods where maybe it's still inconvenient or difficult for folks, or maybe they're elderly and have a hard time getting around, then the question is how to make the vaccine as accessible to that neighborhood or even community as possible. And we have to be thinking ambitiously and creatively about how we get those vaccines to people who might not be as mobile. So one possibility is that there could be a vacant restaurant or other storefront near them that we can set up that's closer to them than another site would be. Another possibility is we have a truck that goes, and other communities have done this, like a truck that's like a mobile vaccination delivery node or even site. So that's not the first thing you do, but are there communities where they're going to have a hard time getting to a vaccination site? Quite certainly, yes. And so the question is, what can you do to help get the vaccine to them?
What's the incentive, though, for a restaurant or bar owner to let you take over their restaurant? Are you going to pay them?
There would be some resources put to work. I mean, we would pay a modest rental fee, particularly if for them, like this might be a way to get a little bit of money in the door. So I think that the Joe Biden plan, the last I saw, was $20 billion for vaccine distribution. And so the question is, how does New York City make use of those resources in a way that helps New Yorkers get vaccinated? And to me, this is a creative way that we can bring the vaccine closer to some people who might have a hard time getting to a site.
And with the ice cream trucks, I mean, there are such things as mobile clinics. Why wouldn't you just use what's already established, within the health industry?
Yeah, the mobile clinics, again, like are one of the first resources you'd use. We saw that other communities were using ice cream trucks in part because they had refrigeration capacity that in some cases is helpful for the vaccine. So we thought if other communities were making use of that, we thought it was in like a creative use of underutilized resources, because you can imagine that it's not like those trucks are being used right now. So if it's helpful, we should be using everything.
Okay, thank you.
Okay, thank you everyone for joining. I really appreciate the time. If anyone has any follow-up questions, they can reach out to me.
Thank you all so much. Appreciate a special thank you to Congressman Ritchie Torres, Dr. Dara Kass, and Assemblymember Ron Kim. You all are tremendous. And, let's get the city back on its feet. Thank you, everybody. Have a good weekend.